Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Colorectal cancer. Introduction. Cancer of the colon or rectum is also called colorectal cancer. It is one of the most common cancers among men and women.
Caught early, colorectal cancer is often curable. This is why screening is so important. Everyone who is 50 or older should be screened for colorectal cancer. Some healthcare providers recommend screening starting at age 45. Ask your healthcare provider when you should start getting screened.
This program will help you better understand what colorectal cancer is and what treatment options are available. The colon and rectum. The colon is also known as the large intestine. It makes up the last 5 feet of the intestines. This section reviews basic anatomy of the colon. Swallowed food first goes through the esophagus. The esophagus is the tube that takes the food to the stomach. Next, food passes through the stomach where it is digested. Digested food goes from the stomach to the small intestines. In the small intestines, nutrients are further digested and partially absorbed.
Fibers and digested food finally reach the colon. In the colon, water and nutrients are removed from the food and what is left is turned into waste or stool.
The colon has several components. The ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus.
Stool is stored in the last 2 parts of the colon, the sigmoid and the rectum, before leaving the body.
Colorectal cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, a colorectal tumor may grow and spread to the liver and other nearby tissues over time. Cancers in the body are given names depending on where the cancer started. Cancer that starts in the colon will always be called colon cancer. Cancer that starts in the rectum will always be called rectal cancer. Cancer that starts in either the colon or rectum may also be called colorectal cancer. It will always be called colorectal cancer, even if it spreads to other places.
Colorectal cancer is one of the most common cancers among men and women. Regular screening is recommended for all men and women over age 50. Some healthcare providers recommend screening starting at age 45. Ask your healthcare provider when you should start getting screened.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors.
It is usually impossible to specify the cause of cancer in an individual patient. However, we do know what causes cancer in general. Healthcare providers also know factors that can increase the chances of getting cancer. These are known as risk factors. Colorectal cancer is more likely to happen as people get older. Being older than 50 is a risk factor for colorectal cancer.
Having colorectal polyps is also a risk factor for colorectal cancer. Colorectal polyps are growths on the inner wall of the colon or rectum. Most polyps are benign, but some can become cancer. Finding and removing polyps early reduces the risk of colorectal cancer.
Having a history of ulcerative colitis or Crohn's disease makes you more likely to develop colorectal cancer. Ulcerative colitis and Crohn's disease are forms of irritable bowel syndrome, IBS. Having diabetes can put you at a higher risk for developing colorectal cancer.
Another risk factor for colorectal cancer is family history of the disease. Close relatives of a person with colorectal cancer are somewhat more likely to develop colorectal cancer themselves. If many family members have a history of colorectal cancer, the risk is even greater. Changes in certain genes can also increase the risk for colorectal cancer. Tests can tell if you have these genetic changes.
There are some risk factors that you can control. You are more likely to get colorectal cancer if you smoke, do not exercise regularly, eat a poor diet that includes a lot of red and processed meats, are overweight or obese, drink a lot of alcohol.
Not everybody who has risk factors for colorectal cancer develops it. Some people who have no risk factors for colorectal cancer can still develop it. Symptoms.
A common symptom of colorectal cancer is a change in bowel habits. A change in bowel habits can include constipation, diarrhea, feeling that your bowels do not empty completely, finding your stool is narrower than usual, frequently having gas pains or cramps, or feeling full or bloated.
Symptoms of colorectal cancer also include feeling very tired all of the time, having nausea or vomiting, losing weight for no known reason.
These symptoms may not be caused by colorectal cancer. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis and screening. Curing colorectal cancer is more likely if it is found early. Regular screening is key to finding cancer early. Screening can begin at age 45 or 50 for most people. Ask your healthcare provider when to start getting screened. Colorectal cancer is suspected if a stool exam shows blood in the stool. A routine and simple test called a fecal occult blood test, or FOBT, can detect blood in the stool. If an FOBT detects blood, it does not necessarily mean that you have colorectal cancer. Many other conditions can cause blood in the stool. If the test finds blood, your healthcare provider will order other tests to diagnose the cause of the bleeding. Routine rectal examinations can detect a growing lesion in the anal or rectal areas. A healthcare provider may also be able to find a polyp or a cancerous lesion during a scope exam of the colon. Depending on your age, personal history, and family history, one of these tests may need to be done on a regular basis. If unexplained blood is found in the stool, these tests become necessary. During a colonoscopy or sigmoidoscopy, a sample may be taken and given to a pathologist who will look at it under a microscope. Discuss your options for screening with your healthcare provider. Options for routine screening include colonoscopy every 10 years, flexible sigmoidoscopy every 5 to 10 years, fecal occult blood test every year, stool DNA test every 1 or 3 years, computed tomography colonography, also called virtual colonoscopy, every 5 years. An ingestible pill camera may be a screening option for patients who have trouble with colonoscopies due to other health issues. The pill camera is a device that you swallow. It takes images of the inside of your intestinal tract as the pill moves through your body. Your healthcare provider will review the images for polyps or other signs of health problems. The images taken by the pill camera may not be as clear as those taken during a colonoscopy. Biopsies also are not possible with a pill camera.
Other tests may also be done to diagnose colorectal cancer. Staging.
If you have colorectal cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body.
Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment.
When staging colorectal cancer, healthcare providers want to find out how deeply the cancer invades the wall of the colon or rectum, whether the cancer invades nearby tissues, whether the cancer has spread, and if so, to what parts of the body.
If colorectal cancer has spread to nearby lymph nodes, it can spread to other areas of the body. Colorectal cancer most often spreads to the liver. Many of the same tests used to diagnose colorectal cancer are used to determine the stage. Additional tests may also be done to determine the stage of cancer. Blood tests may be done to look for certain substances in the blood. High levels of these substances, such as CEA, may indicate colorectal cancer. An endorectal ultrasound creates a picture of the rectum and nearby tissues using sound waves. An ultrasound probe is inserted into the rectum to send out the sound waves. The picture can show whether cancer has spread to nearby tissues. A chest X-ray may also be used to determine the stage of colorectal cancer. It can show if cancer is spread to organs or structures in the chest. MRIs or CT scans may also be used. Sometimes staging is not complete until after surgery to remove the tumor and nearby lymph nodes. Treatment and supportive care. The type of treatment used depends on the size and location of the tumor, the stage of the disease, and the health of the patient.
Treatment for colorectal cancer may involve surgery, chemotherapy, immunotherapy or biological therapy, radiation therapy, targeted therapy, or some combination of these treatments.
Surgery for colorectal cancer depends on where the cancer is located in your colon or rectum. Most patients with colon cancer have surgery to take out as much of the tumor as is safely possible. During the surgery, some of the lymph nodes in the abdomen are also taken out and checked for cancer. If the cancer has obviously spread to other organs in the abdomen, some of that cancer may also be taken out. Depending on where the cancer is in the colon, the surgeon may have to reroute the colon to the outside. This is called a colostomy. Sometimes a colostomy can be closed surgically months later.
Depending on how fast the cancer is growing and whether it is spread to other organs, further treatment may or may not be necessary after surgery.
Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy is usually given in the bloodstream through an IV or by mouth. Radiation therapy is often used in patients where the cancer has mostly affected the rectum. Sometimes it is given before surgery. Radiation therapy is a series of high-energy radiation treatments to the area that has cancer.
Another type of radiation, called internal radiation, may be used to target specific areas. The radiation comes from radioactive material in thin tubes placed in or near the tumor. Targeted therapy may be another option for advanced colorectal cancer. This treatment targets specific differences in cancer cells to try and prevent the cells from growing and spreading. Targeted therapy is usually given with chemotherapy. Talk with your healthcare provider to see if this is a good option in your case. Immunotherapy or biological therapy is another type of cancer treatment for advanced cancer of the colon. Immunotherapy fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Like any cancer treatment, immunotherapy can have risks and side effects. Immunotherapy may not be right for all cancer patients. Some types of immunotherapy are still being studied in clinical trials. Clinical trials test new medical approaches and treatments. There may be other clinical trials available for people with colorectal cancer. Ask your healthcare provider for more details.
Colorectal cancer and its treatments can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, to relieve the side effects of therapy, and to help you cope with emotions. Rarely, people who have colorectal cancer need a colostomy. If this is the case, you will be taught how to care for your colostomy by your healthcare provider. Eating well and staying active can also be hard during and after cancer treatment. Talk to your healthcare provider about ways to help you cope. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cancer of the colon or rectum is also called colorectal cancer. It is one of the most common cancers among men and women. Colorectal cancer begins in the cells in the inner layer of the colon or rectum. The cancer may invade more deeply into the wall of the colon or rectum and to nearby tissues over time.
Treatment for colorectal cancer may involve surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or some combination of these treatments. Colorectal cancer and its treatments can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, to relieve the side effects of therapy, and to help you cope with emotions. Caught early, colorectal cancer is often curable. This is why screening is so important. Everyone who is 50 or older should be screened for colorectal cancer. Some healthcare providers recommend screening starting at age 45. Ask your healthcare provider when you should start getting screened. Thank you for using Explain.